Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, everybody. This is Dr. Kurt Woeller. Welcome to the podcast. So in this episode, we're going to talk about inflammatory bowel disease, specifically Crohn's and colitis, which is something that unfortunately affects millions of people. So I've had a lot of experience with it over the years in clinical practice myself, but I have a specialist today, Josh Dech, who is a clinical nutritionist. He'll give a little bit background onto his background and experience with this. Josh also has a number of podcasts himself, so he's going to talk about that. We're going to talk about health and healing and strategies. So Josh, welcome to the program.
It's absolutely a pleasure to be here. Very much looking forward to the conversation today.
So give everybody a little bit of information about your background and how you got interested in the topic of Crohn's and colitis.
Well, it's an interesting process. I call it falling forward, because my entire life to where it is has just been accidents I never predicted or expected. When I was 19, I graduated from college as a paramedic, and I was working that for a little while, I think just over a year before I ended up making some transitions. But looking back, the things I saw over and over as a paramedic was we pick up the same patients for the same problems over and over again. They go back to the hospital, get the same drugs, a new drug or a higher dose of the same drug, and they'd be sent back home. And we picked them up over and over till they stopped calling because they just died of the condition that they kept managing but never treated. And so through this process, I ended up changing. I was way out on the east coast of Canada, living in Newfoundland at the time, and I decided to move back home to Ontario to try to find another job as a paramedic, something with better pay where I can move up the ranks a little bit. But there were no jobs available. So through a chain of happy accidents and falling forward again, I ended up in Alberta. Here I am, 21 years old, and I picked up a job while still looking for a job as a paramedic. I picked up a job as a personal trainer. I'd been in the fitness space and, competed in bodybuilding and stuff before. And I thought this would be something cool I'll really enjoy. Well, my first client who came to see me, Kurt, was 57 years old. Her name was Lynn. And we actually ended up doing a miniature documentary on her, like a 6-minute mini, because it was such an impressive story. When she came to see us, she was on 17 pills and a shot of insulin for breakfast, 9 pills and more insulin for dinner time. She had all the conditions under the sun. She had skin issues, heart issues, high blood pressure, slept with a CPAP machine. She was on disability at work. So if the fire department got called, instead of her climbing down and running down the stairs, you have to wait and stand there in a burning building for them to come up and get her. And so everything was just falling apart in this 57-year-old woman's life. And by the time she was 59, 2 years working together, 3 days a week, with an hour of exercise, managing basics of nutrition, she was off all but 2 medications. She was no longer diabetic, no longer had a CPAP, no longer on disability, and she popped it one step further. Here this lady is at 59 years old, having just been on disability and 26 medications, to breaking a world record as a weightlifter in the Raw Powerlifting Federation here in Canada.
Wow.
And so, unreal, right? She went from disability and chronic medication to breaking a world record. And so this amazing transition and story of what the human body is actually capable of when given the right tools, conditions, and circumstances. And I started following these threads. And just over the course of having more mentors and learning more and doing my own research, I discovered how important nutrition, health, wellness, and the gut is. And I was at this trade show, again in my early 20s. I was probably 23 years old, 24 years old. And I was at this trade show, and there's a woman talking about the gut microbiome, what it is, how it works, the importance of a vaginal birth versus C-section, bottle feeding versus breastfeeding, how your bacterium even can influence your personality. 30-minute presentation, my jaw's on the floor. And I'll tell you, love at first sight. I looked at this thing, and I watched her speak. And Kurt, I said to myself, I kid you not, I said, this is what I'm doing for the rest of my life. Ended up saving up, went back to school a couple years later, and I became a holistic nutritionist. And I started pursuing the gut until one day, my first colitis client came to see me saying, can you help? And at the time, I told her, I said, I don't know. I said, our understanding of ulcerative colitis is that it's autoimmune. There's nothing that can be done. It's kind of a managing, live with it situation. I knew all the information I was given just like they were. And 90 days later, we started peeling apart some of the layers and figuring it out, not from a textbook, what it told us to do. But we started figuring out the history of her condition and how it developed. We reverse engineered it. And here we were 90 days later, and she had made more progress with us in 3 months than her functional medicine doctor in 3 years. And she was 85% better in just 3 months. And we kept going and going. And that was it. Since then, the rest is history. Here we are. We've got over 300 clients that we've seen now who have reversed their condition, come off medication, gotten their scopes and scans and reports back, and the condition is gone. And that's sort of how we ended up where we are today.
Awesome. So I want to get into all of that. So before we do that, break down the differences and maybe the similarities between Crohn's and colitis. Sort of, there's always the textbook, and then of course, most people don't match the description in the textbook, but let's talk about generalities with regards to these two conditions, from what your understanding is and how they manifest.
I'd love to. And I'd even like to take it one step further, Kurt, and sort of explain how we've changed our personal view, whether it be right or wrong. The evidence that we're seeing on a clinical level with our clients, it appears to be right. We've actually taken IBS and IBD, so irritable bowel syndrome and inflammatory bowel disease, your Crohn's colitis umbrella. We've meshed them together and said they're actually the same condition. They're just a progressive version of the other. And this is where we're sort of breaking the mold. Ever since probably the 80s, they've been trying to separate irritable bowel syndrome and inflammatory bowel disease and say they're different conditions. They're very, very different. And here's why. But even if you look at the data they have now, look at the symptoms, right? It's a Venn diagram, and all the symptoms are basically the same. One is just worse. So I liken it to wearing a pair of shoes without socks where your heel rubs and gets red and it blisters and bleeds. Statistically speaking, 17% of all cases of Crohn's colitis that we're aware of have a previous diagnosis of irritable bowel syndrome. Well, how many people do you see in your practice who have gut issues that represent IBS but don't have a formal diagnosis of IBS? Take it even further, so many. Almost all of them have some kind of irritable bowel-like condition. But take it a step further. Statistically, depends on the stats you look at, between 60 and 72% of all Americans complain of gut issues once a week that correlate to irritable bowel syndrome. So constipation, diarrhea, cramping, gas, bloat, pain, nausea, vomiting, etc. So we have up to 70% of Americans complaining of an issue, with I think it's 20-ish% who actually have a diagnosis, and then 17% of all IBD cases have a previous diagnosis. The math just lines up. One is worse than the other. And so people really get IBD in two ways. The only two ways you get anything, either slowly over many years or very quickly over a few days, weeks, or months, where it developed from healthy to sick. And so we have to look at Crohn's colitis, clinically speaking, as two different processes, but again, progression. So I look at IBS as being the low end of the gut spectrum. Colitis is the next stage, and in my eyes, Crohn's is the one after that. Now, some people will jump from one layer to another. They'll go from healthy to Crohn's. Some will go from irritable bowel to colitis to Crohn's. But let's explain that a little bit. Irritable bowel, we don't need to go into. We get it, right? Symptomatically, bloaty, gassy, not feeling great, food sensitivities.
Yep.
Ulcerative colitis or colitis is just inflammation of the large bowel, but colitis. And what we see is a very surface level inflammation. It tends to go in strips. So think 18 centimeters of the lower rectum might be your colitis proctitis, they'll call it. And it's surface layer, just the very top couple of layers of tissue that are inflamed, typically speaking, and it's in this long strip. Whereas Crohn's disease, for example, can be anywhere from mouth to anus, internal or external. You can get perianal abscesses and fissures and sores. You can get ulcers in the mouth, canker sores and the like. You can have sores in the stomach, small intestine, the bowel, or then they come instead of strips, they come in patches. We call Peyer's patches. So it's like Dalmatian spots, and it's deeper into the layer. So you see why I say irritable bowel is symptomatic. You don't typically see on scope scans and reports any inflammatory markers. You do a colonoscopy, you don't typically see inflammation or lesions. Whereas ulcerative colitis, Now it's specific to the colon where the inflammation is, but you typically still have all the irritable bowel symptoms anyways. Now we're just worse. Now we're presenting with inflammation that's visible to the eye and symptomatically on blood work. And then it goes one step further to Crohn's, where instead of just the colon, it's the entire GI from mouth to anus, and it's spotty and it's deeper in the tissues. And this is why I look at them as progressions of each other rather than being a black and white on or off switch. Again, people can jump around, but this general view, as we get into this conversation, if you maintain this idea that IBS, colitis, Crohn's disease are a spectrum, it's going to shape how you, or reshape, I should say, how you begin to see the bowel and gut health and the progression of gut disease like Crohn's and colitis.
I'm assuming, and tell me if I'm wrong, that you would tend to group small intestinal bacterial overgrowth perhaps in that category or that box of irritable bowel.
I do, and I see it as a connection factor. I mean, there's so many people who also have Crohn's colitis who actually have a diagnosis of SIBO. But consider some of the root causes that we see of Crohn's and colitis can also cause SIBO, or jumping ahead a bit, but as an anecdote, look at parasites. A very common root cause of many diseases, skin issues, gut issues. One of the known symptoms we see with parasites is SIBO, but it's also a commonality we see in Crohn's or colitis. And if you happen to have both in a SIBO condition, now we got correlation.
Let's talk about acute triggers, okay? Because we're going to talk about lifestyle factors and things that develop over time. What in the clients you've worked with, people who come to you, people who have perhaps correspond with you through your different programs, from an acute standpoint, what tends to show up the most? Is it some type of an acute infection, like a parasitic infection? Is it perhaps a vaccine reaction? Is there some trigger from a medication? What are some common acute triggers for a lot of people you see for the inflammatory bowel disease?
I will say it's all the above. Most common roots that we see are parasites, bar none. We see a ton of parasites in our clients. On the other hand, I know we're going to get into lifestyle, but I want to put a little thread here just to stitch them together. Because if we have somebody coming in who gets an infection, maybe they take antibiotics, they get a C. diff infection, there's a good chance their gut microbiome was already unstable to begin with. And then the antibiotics were the straw that broke the camel's back, leading to these opportunistic overgrowths of things like C. diff. And so it's a bit of both, but definitely we see a lot of parasites. We see a lot of layers of fungus, candidas, that type of thing. And also on the fungus umbrella, we see mold or mycotoxins. We see a fair bit of Clostridium bacteria, be it C. diff or other Clostridia species. On that note, we do see other layers of acute infections people got that, again, the straw that broke the camel's back. We'll see antibiotic usage. We'll see E. coli infections. We'll see Epstein-Barr, Giardia, so other parasitic infections. There's a lot of commonalities. But basically it comes down to viruses, fungus, bacteria, or parasites in some way, shape, or form that's getting into the system. But the argument we're making, again, just to bring us back to this IBS to IBD spectrum where things progress and get worse, the argument we're trying to make is that it's not necessarily your body fighting your own tissues and saying your colon is bad, let's get rid of you, or instead, we believe it's fighting the microbiome and your colon is caught in the crossfire. And that's what happens to be inflamed in the area as your body's attacking. I mean, look at an infection. If you cut your hand and it gets infected, your body's not attacking your hand. It's attacking the infection in the area, the pathogens, and your hand is caught in the crossfire. The tissues are inflamed because of it. And that's sort of the ideology we're now trying to take to shift how we see and view inflammatory bowel disease. And we're trying to see it through to prove or disprove that theory.
Any particular parasites that you've seen that tend to be more of a trigger? Perhaps Cryptosporidium, for example, Giardia. Cryptosporidium tends to really wreak havoc in the large intestine, so it perhaps could be a trigger for colitis. Giardia is pretty aggressive everywhere, but it really caused a lot of small bowel problems. So any comments?
Yeah, Giardia, common, especially in daycares, stuff like that, right? You'll pick them up through, childcare, cleaning up one baby, go to another, they pass through stool. Cryptosporidium, I imagine. We see a fair bit of large-scale stuff, ropeworms and others. I have seen a fair bit of D. fragilis or Dientamoeba fragilis. We see E. histo. There's a lot of different ones, but the truth is, Kurt, we're not actually testing a lot for parasites. At this stage, we're sort of beyond the point of when you get really good at something, there's two risks involved, really. The first one is you get a bit too arrogant and you assume, or the other one is that as you're going through, you start to miss things because you're no longer looking. But at this stage, what we do is we see so much in the way of symptoms of parasites that we don't really test. I mean, even the best parasite tests are 40% accurate anyways. And so if we can go through and start to understand the language of symptomatology, this is what the language your body's speaking. We have to look outside of the gut though. Your digestive system, it's got a little more than a dozen words, right? Like you and I, Kurt, if we're having a conversation, we couldn't have a very useful conversation with 14, 15 different words. We'd sound like ooga booga cavemen the entire time.
Right.
But if we start to elaborate beyond the symptoms or the words of your digestive system, we can learn more. Because your gut can only say constipation, diarrhea, nausea, vomiting, blood, pain, gas, cramping, mucus, increased, decreased appetite, acid reflux, bloating. Like these are the words it can say. Whether you've got a stomach flu or Crohn's disease, it doesn't matter. A lot of the symptoms are kind of similar. And so we start to look outside to the vocabulary of the body beyond just the digestive system to help point us towards those root causes. And that's more of what we do at this stage after hundreds of cases of the same things. We see a lot of the same patterns. And now we're using that language of symptomatology to identify root causes in these parasites, 2-3 foot anacondas coming out of people that we often see without having to actually test for them.
It's interesting with regards to some of the acute infections. You think about parasitic infections and what immunologically has to happen to react to them. And then you tie that into things like mold, fungus, Clostridia, etc. I've seen this a lot in some of the autistic kids I work with that get this skewing of their immune system reactions, whether it's the innate immune system, the adaptive immune system. And so everything is being thrown. Let's just take the common parasite infection scenario for example. So the immune system ramps up and throws all of its ammunition, if you will, at these large extracellular organisms. But if they have some other underlying imbalance, the fungal problems, for example, now all of a sudden you get this immunological redirection and confusion, and you're throwing everything at the parasite, but all of a sudden you've sort of taken your eyes off of the fungus. And, it's a very opportunistic organism as well. And we know, as you're mentioning here, whether it's IBS, Crohn's, ulcerative colitis, the immunological reactivity along the mucosal lining of the gut can be very profound. And when we start tipping into that realm of fungus, it has a tremendous ability to increase different types of immune chemicals, cytokines, that can either drive inflammation or cross over into autoimmunity. So I've seen a similar pattern as well, Josh, in what you're recognizing, and I think it's very interesting and important for people to understand. Real quickly before we move on to, let's say, lifestyle and kind of the chronic development, has there been anything you've recognized from an acute environmental exposure? We could certainly throw mycotoxins and mold into that, somebody living in a moldy home. But I'm wondering perhaps if you've seen individuals that have been, exposed to large amounts of environmental chemicals or perhaps heavy metals or some other kind of acute trigger. It could be trauma. It could be, they had some dental work done, and they had a root canal or whatever. Anything else,
Yeah.
Some of it can tie into obviously, being predisposed to certain things, but infections make sense. Anything else that you've seen from an acute standpoint?
Yeah, I like that you brought up, we'll take it back to the analogy you just used of your immune system kind of balancing. I sort of think of our immune system like an octopus trying to juggle. You're bouncing around mycotoxins and parasites and infections and the flu and viruses and dirt, and you're juggling all these things. But if something takes the attention, you have 4 arms going towards all these parasites, you drop everything else, and they become more opportunistic in nature, they overgrow. And so in these acute situations, I typically do see where you get people growing up on farms exposed to molds or exposed to glyphosate or exposed to all kinds of pesticides. But I think, again, it comes back to 3 different ways people get infected, which is acute, chronic, or chronic acute. So it's kind of a bit of A, bit of C or B, where I know my alphabet, where they're both kind of the same thing, where you get somebody exposed to heavy metals, for example, which it is an acute exposure, which leads to a chronic dysbiosis or an inflammatory state that then their immune system collapses, allowing other things to come in. And so it's a little bit of things in both camps. But on the other side of that, I can't say I've identified anything major or vaccination. But again, look at this where your body's like a glass of water. And if my glass of water is 1/4 full and I shake it up and really disrupt that, you get sick. You go on a run, you're over exercising, you're not sleeping, you're highly stressed, you're shaking that cup. It's not really going to spill and overflow water all over the place. On the other hand, if that cup is almost full to the brim and you disrupt that even a little bit, you're going to spill, you're going to have symptoms of disease. Or again, it's already so full, it's already bubbling. If you think about if you've ever filled a cup of water to that forms a bubble on top, where if you just add one extra drop, it's going to fall. That oftentimes is what we see happening to people as well. Through vaccination, through exposure, they go, oh, I had a traumatic event and that caused my bowel disease. I said, no. That was the straw that broke the camel's back. Your cup was already full. A healthy person doesn't go through a traumatic event and begin to bleed from the bowel. Something else had to have been there beforehand to allow this cup to overflow. And so that's sort of how I view these chronic and acute or acute chronic situations.
I completely agree. You're spot on. And these are things I've seen clinically over the years as well. Where would you put, let's shift gears real quick. So we're not really shifting gears. We're just maybe slightly shifting gears. But where would you rank mold mycotoxins in this discussion of I'm trying to stay away maybe from the acute triggering event, right? Because we understand that there's always this backdrop to things. Of course, yeah. But as far as things in your experience in this space, mold mycotox exposure, as far as a trigger of events, perhaps the straw that broke the camel's back, so to speak, as you just described, compared to other things, compared to, let's say, glyphosate or other chemicals. Any thoughts on that?
Yeah, mold mycotoxins, I would say, are a major, probably a top 3 for us that we see. Parasites, mold, and other fungus, of course, and Clostridia, I would say, are probably our top 3 that we see. Second to that would be your E. coli's and other types of acute bacterial infections, with the underlying, we find the underlying structure or the weakening having been a chronic exposure to glyphosate, to chemicals, toxins, etc.
So it's important that you bring that up, Josh, because if people recognize what you just described, every one of those are microorganisms, right? So you have parasites or living organisms, you have bacteria, Clostridia bacteria, you've got mold, fungus. And so what's happening is that our immune system has developed from an evolutionary standpoint to recognize various organisms that are also in the natural world. We're part of the natural world, so are they. Many of them become part of our body, like part of our, it's thought that the mitochondria have a distant relationship to bacteria from an evolutionary biology standpoint. And so when you actually study the relationship and the inner functioning of the immune system, particularly the innate immune system, and particularly the mucosal innate as well as adaptive immune system, it's developed along the same lines as things it's exposed to from a microorganism standpoint. And that also includes our microbiome. So there's an interplay. And we react to these things in a very strong way immunologically. Sometimes we overreact, which is where we generate the inflammation and then the autoimmunity. And so I'm like you, chemicals, yeah, problem. Heavy metals, most definitely. But usually those things are creating a weakness in the immune system or causing the immune system to sort of falter to where all of a sudden some underlying pathogen or a group of different opportunistic organisms can now be expressed. And all of a sudden our immune system tries to catch up. And I love your analogy of the octopus. That's fantastic. I'm going to probably use that. I will give you credit in the future for that.
Thank you. We'll put that on a t-shirt for sure.
Yeah. But so in my experience, the mold and mycotoxin is just a major immunological trigger for a wide variety of things. Some of the sickest patients I've ever seen are people who've had mold mycotoxin exposure and still are. I mean, one of my first cases goes back many, many years when I saw a woman who had been exposed to mold in her condominium complex, and I was overwhelmed, at that time in trying to figure out what to do. But it still followed suit. It still plays out that way. So I knew you were going to say that, but I really actually liked more than how you framed it, and from the standpoint of certain bacteria, fungus, mold, parasites. Again, all of these different microbes. Okay, let's come back and let's talk about lifestyle factors. And in part of this discussion, we cannot get away from diet. And I'm going to ask you perhaps some questions about maybe specific diets, although, I don't want to pigeonhole people into one particular diet. But let's talk about lifestyle factors. What are you recognizing in people that are coming to you, commonalities in lifestyle issues that have contributed to some of these problems?
3 simple things. Number 1 is food consumption. Number 2 is stress levels. The third is lack of movement, whether that's indoor or outdoor. We have to look at the ways we have to heal the body. The first thing we do with people when they come into us 99% of the time is drainage. So if we look at detoxing and drainage, detoxing being the gathering of the garbage, drainage being taking it out to the curb and getting rid of it. So your body has these drainage and detox pathways. You look at your liver, your bile ducts, your lymphatic system, your gallbladder. We look at your skin, your lungs, your sinuses, the bowel, and the intestines as a general whole. We look at ureters in the bladder to excrete. These are how things either move, transport, or exit through the body. And these are often things that are blocked up. We need movement, for example. Your veins have valves that are open and closed by pumping from the heart. On the other hand, your lymphatic system has valves, but there's no pump. Your muscles actually move, which cause this opening and closing of valves, like milking the lymphatic system. So if you are stagnant and static, not exercising often or deliberately with intention, you're not actually getting the movement you need for one of the primary detox pathways and immune pathways in your body. So things get sluggish, traffic gets jammed up, and now the city's at a standstill and you wonder why you're sick, because the garbage men can't take the garbage out to the curb. It can't go anywhere. So it just piles up and makes your house toxic and people get sick. And we have this happening all over the place. And so we look at sickness as a general whole. I think I'm getting off track now. I do want to bring it back. Like you said, Kurt, it is all microbes. Our lifestyle, what we eat. If 80% of the standard American diet, ironically the SAD diet, is processed food, it is damaging our ecosystem. We have an unspoken contract that's been living since the beginning of time. Whether you believe we've been here for a few thousand years, hundreds of thousands, or millions and billions, it doesn't matter. Since the beginning of time, human beings have had a contract with the microbiome, the parasites and fungi and viruses and bacterium that live inside of our gut, the 50 to 100 trillion of them outnumbering us, depends on who you ask, 1 or 2 to 10 to 1, but it's a lot. The idea being, they have eaten foods that they have always eaten. They have been given an ecosystem. The contract says we give you a healthy place to live. We exercise, get sunshine, get outside, bring more community and environmental exposure into you so you can grow and thrive as a better community, as a colony inside my body. In return, you detoxify me, you help promote rejuvenation, you take 70% of my immune system is made and housed and matured there, my immune cells. You make 90% of my neurochemicals, what my brain needs to function. You govern my personality, provide vitamins and create certain B vitamins, vitamin K. You do all these things for me, and I do this for you. In the last 100 years or so, we have broken that agreement. Human beings have been putting more processed food, refined foods, things that never existed since man first walked the earth. And we've broken that contract. The ecosystem is sick. Now we have suddenly an imbalance of our microbes, our fungi, parasites, viruses, and bacterium. They are imbalanced and they are getting sick and we are getting sick. But then again, there's a direct correlation. Look at the rainforest, the most diverse ecosystem on Earth. By far, unquestionably the most diverse. On the other hand, that ecosystem, if you throw fire on it, salt on it, whatever, it'll grow back because it's so robust. But look at ecosystems that lose diversity. Look at farming and agriculture, monocropping. We till the soil, destroy the microbial ecosystem in the earth. These foods are void of nutrients. They die very easily. They're covered in pesticides. So we lose diversity. We therefore lose life. Our guts used to be the Amazon. They're now an old industrial farm. And this is a problem we're seeing. So the lifestyle factors really are our food, our exercise, and our stress levels, which directly impact that ecosystem like an industrial farm where we're destroying and tilling and adding chemicals and junk and all the life dies. And this is what I believe is at the root of all of us being sick. Even bowel disease, we bring it back to fungus. Like you said, it's a microbe, it's alive. We look at bacterium, parasites, viruses, they're alive. And once this ecosystem is imbalanced, we get sick. The earth is sick, we are sick. And it's this back and forth, push and pull, and we're dying because of it.
I love that. Our gut used to be the Amazon, and now it's some old industrial farm. That's great. That's so very true. Diet is obviously an important topic. And, unfortunately, we live at a time where, there's a new diet for everything. And it drives you nuts, and patients come to you like, I don't know what to eat anymore.
Mm-hmm.
So yeah, I know there's specific uses of certain diets for specific things for, a certain period of time. I'll give you an example. So years ago, I had a couple patients actually with Crohn's who did unbelievably well with the specific carbohydrate diet, which was outlined by Elaine Gottschall many years ago in her book, Food and the Gut Reaction. And then that second edition or third editions or how many other editions was Breaking the Vicious Cycle. And so I would say, by and large, that, in quotes, diet really shifted the narrative for people with inflammatory bowel disease, and then that's transitioned, obviously, into irritable bowel, etc. We've used that dietary concept, too, in the autism world because many of these kids have sometimes documented inflammatory bowel disease or at least suspected. And so it clearly helps, and that was sort of the reasons it was originally developed. Do you have any direct experience with that particular diet program?
I do and I don't. It's something I've seen a lot of. I have a lot of clients. Out of the hundreds we see, we do have a lot of people who are using it. They use SCD and AIP and all kinds of different diets. But I look at food, obviously, right? We just talked about how food nurtures our ecosystem. But most of the people that come to see us, they're not arguing to keep McDonald's and Taco Bell and gluten in their diet, like whatever it takes. And at this stage, most people, unless they're brand new, already know what foods do and don't bother them. And so we don't typically look at these. We say, okay, well, food is not fixing the problem. Again, your cup's already full. Food is just not adding more water to that glass. And so it's an important point of consideration, of course. But like you said, they all have their own uses. Like SCD, it can change what you are or are not feeding in the body, what your body may be hyperreactive to. Because nightshades, for example, most people can eat eggplants and potatoes and tomatoes and not really have a problem. Maybe it shakes up the glass a little, but again, your glass is full. So a little means a lot for you. But look at like the white diet, for example, where they say eat anything that's white rice, white bread, white pasta, white cereals, white. The reason that works, for example, I picture eating food like going for a walk. Let's say you have a sprained ankle, right? Your bowel's inflamed. This is a correlation. You have a sprained ankle and you're trying to walk up a flight of stairs. You can limp along and get up the flight of stairs if you need to. But if you add weight into your backpack and then climb up the stairs with a sprained ankle, it's going to cause a big problem. You're going to have a lot more pain. On the same end, the less mechanical load you put on the GI tract by eating white foods that break down in your mouth. The amylase in your saliva breaks down those starches into sugars. You can take a soda cracker and chew it for 60 seconds, it'll taste like sugar. It'll taste sweet in your mouth because you've broken it down, which means there's no work for your digestive system to do below the mouth. Therefore, you feel better because you took the weight out of the backpack. If you go and eat beef jerky and broccoli, these take a lot of mechanical labor, like adding weight into the backpack with a sprained ankle and walking upstairs. Now, you're requiring mechanical labor and work out of your inflamed digestive system. You're requiring damaged tissues to put in effort. Of course, you're going to have more pain. And this is what I see, number one, is the mechanical. Number two, it's what are you feeding? If you have a lot of parasites or fungus, fiber might be a big issue for you. If you don't, I have a lot of clients who eat tons of fiber, seeds, nuts, fruits, they feel fine. And so it depends on what you're feeding in the ecosystem and what byproducts they are producing. If you have big, bad fish and they're the dominant ones in the pond, they eat first, which means they poop out bad things. But if there's only a few of them and you're feeding prebiotics and good healthy foods to the dominant species, which are good for your ecosystem, they poop out good things and it helps your body. And this is sort of how I see diets. They're important, but also not. And I base them based on how our clients are feeling. Can you eat this? Is it good for you? Number one. Does it correlate to this contract and agreement we've had since the beginning of time? Number two, can you tolerate it? And that's really what I look for in foods, less so this diet type as an umbrella.
Yeah, and that's very important because I think it's important, people listening to this, is there is no one diet, or there's healthy eating, there's healthy lifestyles, right? But to say, well, buy this book and follow this diet to a T, that doesn't apply to everybody. And it's like anything in medicine and health, things are sort of effective from a general standpoint. As I mentioned before, there's really no one protocol that's 100% effective for everybody. Protocols are only as good until the next person doesn't work on, then you have to kind of figure out what else to do. I mean, I realize dietary interventions are a starting point, like the specific carbohydrate diet is a starting point. To take somebody who's on a typical SAD diet, right, standard American diet, and start to move their system towards another way, whether it's, trying to incorporate more whole foods, et cetera. And we could get into the carnivore diet or the GAPS diet and these kinds of things. But my experience, and it sounds like yours as well, is that they're effective for select certain amount of people for a particular period of time based on individual tolerance and acceptance. And the conversation of diet and food, sometimes it's a moving and transforming thing. It's not always a perfect fit for everybody. And so sometimes there's just a learning process that has to occur over time. With that said, okay, when people come to see you, to just give people some hope and some ideas about the idea of understanding diet and what they're consuming, how does that frame out for you when you're thinking about a typical person with Crohn's, colitis, who's suffering greatly? How do you guide them? What kind of general recommendations do you provide that people coming away from this podcast can say, okay, I get it, I want to go do some more research? What does that look like?
That's an excellent question. So I would start with the framework of the SCD or the AIP diet. So they're there for a reason, and they work 70% of the time for a reason. They help reduce symptoms because, again, they're not adding to the cup.
By the way, the AIP is what? Autoimmune
protocol, yeah.
Yeah, tell everybody what that is.
So that's just going to be, there's a different AIP, but AIP just means you're pulling out some of the basics that cause inflammation or cause irritation. Your nightshades, you're pulling out gluten, dairy, common triggering foods, but generally it's a very whole foods based diet. Whereas SCD, well, again, specific carbohydrate diet has specifics per that one. There's lots of nuances to go into on these ones. But keep in mind, they have restrictions for a reason, but that doesn't mean they're restrictions for you. Like the AIP, for example, I might have one person pull out nightshades like eggplant. I might have another person put them in because they know they can tolerate it. But this is where, look at all other diets. I just want to regress to this one. You mentioned carnivore. I love the carnivore diet. I've tried it myself. I felt amazing. But I also had a candida overgrowth and parasite issues, which both love the carbs and the fibers. So I stopped feeding them. My symptoms reduced, but it didn't fix the problem. And so I think a lot of these things, ultimately, elimination is key. Unless you're eating foods that your great-great-great-great-grandparents would recognize as edible foods they could have grown in the garden, you're eating the wrong stuff. That's that simple, right? Would great-grandmother recognize this as edible? If not, don't eat it. That's number one. Number two, what we can say is let's generally go towards foods that are not putting weight in the backpack. So maybe eat a lot of ground meats. They're generally easier to tolerate. Look at softer foods, sweet potatoes and squashes and steamed vegetables rather than raw vegetables, canned fruits. These are typically where I like to say to go to. If you're concerned, stick to berries or skin the foods. But for example, there was a while back, I had a really bad parasite infection, and apples were on sale at the organic market down the road. So I thought, I love apples. I was having an apple kick that year. I'd eat 10 of them a day. After the second week, I started bleeding from the bowel. I had blood in my stool. I'm like, well, this has never happened before. I did the math back and figured out my symptoms and went, oh, right. I must have a parasite infection. They loved eating the apple pectin and fibers. And so it ignited my parasite infection. And so we have to keep in mind, I think ultimately the gold standard of where I would like to go, if people had in general the tolerance, the patience, and the discipline to do an extreme elimination diet, go down to just taper yourself down to a carnivore. Do that for 2 weeks. And then if you're tolerating meat very well, of course, but this is just an example, taper down to what foods you tolerate. And then every 3 to 4 days, add in one new food. That's the gold standard, elimination and slow progression, because what you'll do, look at IgGs, for example. It's an immune response your body gets, even with a healthy gut, but it's an immune response we get elevated when we have an unhealthy gut to foods getting into the bloodstream. When you have leaky gut, you get lots of bad foods. This response takes 3 to 4 days to peak and 2 to 3 weeks to come down. This is why we say eliminate fully as many foods as you can tolerate for 2 weeks or so. And then every 3 to 4 days, we'll add a new one. Because you wipe your slate clean, you're already bloated and constipated or having diarrhea and feeling nauseous. Your appetite's all over. Give your body a chance to clear out all this immune response and chemicals, give it a reset, then slowly add back in. So perfect case scenario, reduce to the AIP or the SCD. Just do a Google search and pick those foods to start. If you're already eating like that, cut down further. If you're not, it's a good place to start because it's 80% better than what you're doing now. And then we'll progressively, slowly add new foods back in. And you'll know what you can and can't tolerate at this time. But keep in mind, tolerances are temporary. Once your gut starts to heal and your microbiome starts to restore, you'll be able to eat more of these foods. But I will never advocate. There are a lot of people out there saying good foods, bad foods, and calling it food elitism. I think this has been pushed by big food, that eating junk food has a place. Like the dose makes the poison, or there's benefits in moderation. Well, crystal meth in moderation is not going to kill me. Doesn't mean I should be doing it once a week, So
Right.
considering that with your food options.
So great information, and very interesting about the carnivore, with regards to shifting towards that and then realizing, wow, I was eating a lot of carbs, apples, parasites, utilizing that for their own growth. Some very interesting clinical clues in all that too, that people can start to understand and look at. And I think really, it comes down to, that balance, optimizing, the whole principle of many times when it comes to diet, it's not only important what you put in your mouth, but probably even more important what you don't put in your mouth. That particularly is very true of a lot of the refined foods, your old, worn-out, conventional farm scenario, as opposed to the robust beauty and nature of the Amazon forest. Let's talk about the microbiome. We could have an entire conversation about this. We know that the microbiome, is this robust community of organisms that live within us, thrive within us, but they're not just bystanders. They're not just hanging out. They're actually, they play a direct role in our biology. They produce short-chain fatty acids that influence cell function and mitochondrial function and immune function. They help stimulate certain cells of the lining of our gut to produce mucus, to increase that mucus layer. And where I want to avoid, Josh, is getting into the what's the best probiotic, kind of a thing.
Absolutely.
Because that's just, it's not to say it isn't helpful, but in the grand scheme of things, it's marginally helpful in the greater context of trying to change the narrative here with regards to lifestyle, exposures, etc.
It's even more nuanced than the diet question. So I absolutely agree with you.
Yeah. So, okay, and we certainly could talk about Akkermansia, for example. This is kind of the latest, greatest, and it certainly has. I don't want to downplay because I know they do have importance, and I use probiotics in my practice all the time. So, but I'm always taking a broader view. I'm always pulling the lens back and looking at things from a broader perspective. We'll come in clinically and use different supplements in targeted ways for a period of time. There are certainly probiotics that are great at getting after Clostridia or sort of fighting back some of the immunological reactions against Candida, so they are important. But really, the true story of restoring normalcy as best as possible to the microbiome, I believe, comes from diet, lifestyle, and probably goes back to the three things you mentioned, in the context of what leads to problems. So I want you to take the lead on this.
Sure.
From that greater perspective, what has been your experience of the importance of the microbiome, the role that it plays in health and disease, and then what can we do from a general natural health standpoint to improve its functionality?
Yeah, our microbiome is everything. It is the reason we are alive and healthy. It modifies and modulates your genetic responses in DNA. Like, I argue our microbiome is as, if not more important than our DNA. Our DNA does lots of great things for us. It makes us who we are, but your microbiome influences that directly. It can turn on or off certain genes. There's a study of nutrigenomics, how nutrients influence your genetic expression for better or for worse. Well, how do you think you get nutrients into the body? By breaking down, digesting, and absorbing based on the quality and quantity of your microbiome. And so if that's not healthy, none of us can be healthy. The healthiest ecosystems have diversity. So, I agree that there is a time and a place for things like spore-based probiotics, which are kind of like seeds that plant a tree that continue to grow fruit for your gut, or probiotics that you just take. Sometimes they're dead. They come in, they come out, but it's the postbiotic benefits you're looking for. They've hooped out as their benefits you're taking in. They act like signaling molecules. But it goes back to the story, right? You know the analogy, teach a man to fish. You could either give a man a fish and feed him for a day, or teach a man to fish and feed him for a lifetime. The same thing happens with your gut microbiome. You can give it a fish in the form of a capsule or something on a daily basis for forever that kind of comes in and out and passes through, or you can nurture it and regrow it in the ways it was originally designed to regrow through natural processes. So that first one, best case scenario, your gut is grown and developed from mom. We actually know you get some microbes in utero before you're born, coming through the birth canal via vaginal birth, not C-section, bottle feeding or breastfeeding, not bottle feeding. There's direct correlations to disease and SIDS and all kinds of stuff from that. Growing up, vaccine-free, antibiotic-free, playing in the dirt, getting outside. Best case scenario, you're born in a bathtub on a farm and you play with the animals all day. Worst case scenario, you're born in New York City in a hospital, you're stabbed and vitamin K'd and you're antibiotic and you live in a high-rise with no animals and you sanitize your hands every day. That's sort of the spectrum. So how can we live our lives today as well and as normally as we should have, or as we could have been? Living on a farm. Or if you can't go to a farm, have pets, visit friends who have pets, stop hyper-sanitizing everything in your home, right? There's so many ways. Exercise benefits your gut microbiome, and in turn, that microbiome benefits you. We've seen mouse studies where they've taken metabolically unhealthy, obese, sick mice and introduced the microbiome through feces of healthy mice who have exercised. They gave the healthy mice bacteria to the unhealthy mice, and without exercising, they gain benefits of exercise because it is a direct correlation. Like there's a give and a take. Everything in the body is a give and a take. And this again goes right back to, I'm sort of off track now, but just to understand that your gut cannot become inflamed randomly. Everything in the body is a cause and effect. Me bending and straightening my arm is the cause of contracted and relaxed muscles, the effect being a bent arm. Pink eye is because I didn't wash my hands after touching my butt. I got bacteria in my eye and now it's infected. Inflammation is a reactive response due to imbalanced microbial activity. All life is microbes. So we have to go back to nurturing it with those three basic things. Eating high quality, non-pesticide ridden foods. If you don't know where to get them, drive 2 hours out. If you're in New York, drive to upstate New York. Lots of farms out there. Talk to the farmers. Go with some friends. Bring a cooler. Buy a half a cow and stick it in your freezer. Grass-fed. You can ask them, what sprays do you use on your foods? Organic labels are expensive. But I got a farm that I go to. They do one fungicide spray every year on the ground, and that's it. They don't spray the rest of their food. I'm accepting that. It's better than the 20,000 pesticides they use in the USA.
Right.
And so food, exercise, and exposure, getting into proper environments, seeing people, hugging friends, all basically the opposite of what they did during COVID, which is isolate, sanitize, and stay indoors. Go outside, see people, don't sanitize, eat food, and enjoy your life. And this is how our microbiomes continue to cultivate and grow. And outside of therapeutically inducing or introducing microbes through fecal transplants, through probiotic usage, or whatever other methods, this is the only way that our bodies get introduced. We have to introduce.
So this is the concept, and what you're getting at is doing things to train your immune system. You're training your immune system through different exposures, and through food and lifestyle, seeing people, being in the natural world, being exposed to things. So that's all great fantastic. Let me just come back real quick, because I mentioned about probiotics, and I don't want to give the audience some impression that I'm against probiotics, because that's not it at all. I use them a lot in practice. I use them for specific purposes, but I do not use them, or my intent is not to use them as a replacement for a healthy diet. I tell people all the time, I can come up with a really great, fantastic supplement program, but nothing's going to override a lousy diet. So to be able to maximize nutrition and utilize those nutrients, you also need to complement it with making an effort towards improving your diet. So, but the reality is, and where people are in certain select sick populations of people, they're so far behind in nutrient status that you sometimes have to use things to try to get them caught up, fill in the gaps nutritionally, and the same thing would apply to probiotics. But again, it's understanding why they're used and what role they play. Let me ask you, not everybody, right, has the ability to drive to upstate farms in New York, or, they're city locked or whatever it is, or, the sad reality is you may have people that are in environments where they just can't get away from, the smog, the smoke, the chemicals. So I know there's no perfect solution, but in those kind of scenarios where, you have sort of less ideal living environments, what can you give people some hope who may be in those circumstances to at least try to move the needle a little bit for them, to try to change the narrative of their underlying health?
I think that's an excellent question, because I know as practitioners we can, doom and gloom and, everything's burning, but there is always hope. Your body is constantly draining and emptying and detoxing and cleaning you. So instead of aiming for perfectionism, aim for reductionism. For example, if you don't always have access to perfect healthy foods, you can reduce your exposure by simply going to the Environmental Working Group, ewg.org, and utilizing the Clean 15 Dirty Dozen list. The Dirty Dozen are the 12 foods that are the most pesticide-ridden every year. It's strawberries, apples, grapes, spinach, these types of things. And then the Clean 15 are the ones you don't really got to worry about. Your pineapples and root vegetables. So this is where we can begin to reduce. Like right now, like this shirt I'm wearing, it's a little bit more expensive than I typically spend on shirts. Like to spend $20. I think it was more like 50, but it's an organic linen cotton blend, for example, versus a polyester chemical. So over the course of many, many months, I'm replacing, as my shirts start to wear out, I'm time to replace. I'll just wait a little longer and buy one that's a higher quality, that's an organic cotton or a nicer fiber. So I'm not getting that chemical, for example, or changing out my deodorants. If you don't have the money right now to replace all your deodorants and personal care products, as they run out, look to buy something different. $4 for a bar of soap as opposed to $2. So you pay more for poison-free food and chemicals and products, but you get quality soaps that are not made with phthalates and hormone-disrupting chemicals and these endocrine disruptors. So that's what we use instead. My deodorants are shifted out. There's great products and great companies that are, say, aluminum-free and chemical-free. And so it's just a matter of gradually transitioning. Think of it this way. Your body has a broom and a dustpan to clean itself up. It's more than enough for what your body's doing. Not to say it's not advanced, but let's talk about the amount it's meant to get rid of on a daily basis. Has a broom and a dustpan just to clean up the basics that our human body has been exposed to since the dawn of time, minus the last 200 years. On the other hand, we are dumping a landfill's worth of trash into our body every day. Smog, smoke, chemicals, personal care products, alcohol, fast food, fried foods, clothing made of polyesters and plastics. It's getting into our system. And so the broom and dustpan is no longer enough to clean it up. But if you can simply reduce the amount of trash you're dumping into your body, then the broom and a dustpan suddenly becomes adequate at the very least, and you're reducing the amount of work your body's trying to do and its built up toxicity. And so reductionism, not perfectionism, is more than most people need.
That's awesome. That's perfect. That was perfect. And I'll take it one step further, although you're on the same track. It's the foods, deodorants, but again, it's cleaners you use in your home. It's getting away from the scented laundry detergent. It's cutting out excess chemicals that we're exposed to. That too adds to the bucket. I've often commented that people essentially are born with a certain size bucket, perhaps, of what they'll tolerate. Some people have a very small bucket, others have a very large bucket. So it takes a little bit more to fill up their bucket. But all of us, just living on planet Earth, are walking around with some stuff in our bucket. But like your scenario that you had mentioned earlier about the glass of water, all of a sudden it's full and you add one more drop and it spills over. That's the same sort of scenario with the bucket. So it's the reductionism is very important and very much part, I believe, of this discussion, and very, very true. So, Josh, it's been fantastic. And I love the way you describe things. I love sort of the way that you mold the conversation and give really, interesting, clear-cut examples. I love that Amazon, old worn-out farm kind of scenario. that really is good. What about, let's talk about sleep real quickly, exercise. That falls into the whole lifestyle factor, right? So what have you recognized in individuals with inflammatory bowel disease, perhaps that sleep deprivation may play a role? And then let's finish up on exercise.
Well, those are excellent questions. And that was actually a massive oversight on my part there, Kurt. I mentioned food, exercise, and stress levels, but I neglected to mention sleep. That is one of the biggest things. That's your body fully recharging. It actually does different detoxification steps while you sleep, for example. It recharges on a cellular level, a mitochondrial level. These are some of the most important parts of detoxification. So we go, let me clean out my liver. Let me take a binder for some of the chemicals and toxins. Well, on a cellular level, if you are not healthy, you're not going to detox anyways, no matter what you do on a macro level. And a lot of that rejuvenation is done while you're sleeping. And so there's a couple of disruptions we'll see with people dealing with inflammatory bowel disease. Number one, they're getting up frequently in order to use the bathroom because the urgency is so severe. Or say there's a parasite infection, for example, which is actually causing neurological irritation, which leads to them waking up 2 to 4 in the morning. That adrenal activity they're getting, their adrenaline is always on the move. And so they're waking up because of the issue and going, well, since I'm up, I'll pee or I'll use the bathroom. But in reality, they could sleep through the night if they didn't have this problem. So it's sort of a chicken or egg scenario. Is it that your urgency due to another infection got so severe you're waking up, which dropped your immune system, allowing parasites in? Or do the parasites come in, causing a change in your sleep, causing this adrenal issue? Either way, they all got to come out. So sleep is a major, major part of it. Having good sleep hygiene. We get about this is from Molly Eastman, actually. She's a sleep expert. And she was on my podcast talking about this. She had said on average, we get 100 times more light at nighttime than we should. After the sun is set, it's just moon and stars. We're looking at our cell phones, playing TVs. We get 100 times more light. Your body responds to sound, to frequency, to chemicals, to light more than anything. And that rhythm, that sleep-wake cycle, which is part of your rejuvenation, energy, and detoxing, is correlated to light. And so if you're getting 100 times more light at night than you should be, you're not going to be sleeping properly. And during the daytime, we're indoors, we're in office buildings, we're getting 100 times less light during the day than we should. And your cells aren't being exposed to blue light or infrared light from the rise and fall of the sun. So we're not getting that pre and post light that we should. Another major reason why we're so unhealthy. And so we have to start to look at, we can go deeper. I'll just surface it. Certain microbes, they'll feed off of certain chemicals, serotonin. Parasites love that stuff. Are you kidding me? And so around full moons, there tends to be an increase in serotonin, for example. Parasite activity can ramp up because they like that. They'll consume some of these chemicals, if I'm getting my math right. But there's all kinds of things that they'll do in response to sleep-wake, to the chemicals in the body, your melatonins and serotonins. And we have to sleep. We have to encourage healthy sleep. And so I might sound crazy to some people, like old-fashioned, but I have walked around my house at nighttime with a candle. So I'm like, that's infrared red light. I can view that and not disrupt my sleep. Whereas if I use my cell phone in a bright white light, which is blue light frequencies and wavelengths, I'm disrupting my sleep. And so there's a lot more to it than meets the eye. You have to sleep.
Exercise. Let's finish on that topic. So, really, it could just mean moving more, getting out the couch, going for a walk after dinner. It doesn't always have to be, you're hitting the gym 6 days a week, farming, whatever, just being active. I'm assuming, again, I'm coming back to the assuming question. Please let me know if I'm wrong. But movement. You mentioned the lymphatics, movement of blood, the movement of circulation. It's very much occurs through our own movement. So what generally do you recommend for that typical patient with inflammatory bowel disease to consider when it comes to exercise?
I would consider exercise the tolerance. It's really important. I mean, 90 to 92%, depends on who you ask again, of the entire US population is not metabolically healthy. And so if we're running metabolic functions, that's anything we use to maintain life on a day-to-day basis, not just weight gain and loss, but hair growth and energy and sleep-wake cycles, digestion, this is all metabolism. And most of us are not healthy in those functions. But most of us are going out and doing what we see online or on Instagram. We're doing HIIT workouts, high intensity intervals. We're going balls to the wall when we're working out, building up massive amounts of lactic acid, working till failure. If you're the type of person who exercises, you build up this lactic acid, this burning in your muscles, and you end up running to the bathroom, your liver filters about 4 liters of blood per minute for the average adult. Well, all this lactic acid is in your blood. Your liver's so junked up and sludged up from your bowel issues, your toxicity, it's not processing that. It dumps it down the bile ducts into your intestines, and now you got diarrhea. So you're exercising beyond a point where your body can handle the cleanup crew, the repair crew, all of that. And so more is not better. In general, if you have gut issues, I would say 60 to 70% RPE. That means rate of perceived exertion. You get out of the gym, you're like, that was a 7 out of 10 difficult today. I'm good. Because the magic of exercise, yes, there's the movement. Yes, there's the detoxing, the sweating, these aspects of good physical intense exercise. But the benefits we really get are also on the recovery side. If you have inflammation in your gut, you're not breaking down and repairing your body very well because you're running out of nutrients. Think about your body as a home living on an acreage. You have a well and you live on well water. You have enough water in this well. These are your nutrients to bathe, to cook, to clean, to do your basic day-to-day things. That's how much nutrient you have in this well for your house. Well, now your house is on fire. Your gut is highly inflamed. Everything's up in smoke. You need excess water. You don't have enough in the well. So you go and draw it from other wells. Your hair, your skin, your nails, you pull minerals and nutrients away from those things in order to give your body its main functions for survival. It can live without hair. Your body can live without nails. Your body can let your skin go to shit and break apart because you don't need to build that to survive, really. You need your intestines, your microbiome, your brain, your heart, your lungs, your liver, the basics. And so your body begins to rob resources from other places. But now your well is also damaged, so you can't replenish that water. Your gut is too inflamed to break down, digest, and absorb proper nutrients. Now you're in a deficit. You're in debt. And so it's going to take a while to rebuild that. So why add more debt by causing more breakdown in the body by exercising extremely hard? Do enough exercise to move things through and detox to give your body some relief before you go to break it down, hoping it's going to rebuild itself stronger, because it's not going to happen in these cases. So 60 to 70% difficulty, get a basic sweat, single joint exercises, leg extensions, maybe some lunges, bicep curls. Don't go doing heavy deadlifts or heavy barbell squats. Keep it simple, 30 minutes a day, 4 or 5 days a week. If you're feeling tired, take a day off. If you're feeling energized, go in that day. But don't take advantage of the energy and overdo it and cause more breakdown than your body can really handle. Sometimes when people start to feel better, they forget how sick their body still is. And we just want to be cautious of that as well.
I've seen that happen over the years. People start to feel better. Very classic in chronic fatigue syndrome, for example, like, hey, I'm feeling pretty good. They'll go for a run, or way overdo it, and then they're in bed for 3 days. So it's learning how to listen to yourself. It's learning how to be patient. It's learning to understand that it's a process. It doesn't happen overnight. You didn't get sick overnight, typically. So it's a process of getting back to sort of consistency and letting things evolve, understanding that some days are going to be better than others. And it's an ebb and a flow, just like life is. And it's a process of healing. So, Josh, tell us about your podcasts. How do people get in touch with you, learn more about your work?
I'll be happy to share. And thank you so much for the opportunity to share some of this information just with your listeners here. And it's always nice to have a platform with others that we really know, like, and respect. I mean, I've learned so much from you and your work in the past as well. So it's a pleasure to be here. If you guys want to learn more, everything can be found at gutsolution.ca. That's Gut Solution, all singular.ca for Canada. We got 2 podcasts. You can click the podcast section. One is Reversible, the ultimate gut health podcast. It's all things gut related. Dr. Woeller was on there with us as well. Episode 2 be published. We have lots of experts from all over the world talking about all things gut related. But I've recently started a second podcast called Reversing Crohn's and Colitis Naturally. And I do every single week, I do these 30-minute lives or lectures plus a Q&A in my Facebook group, and those audios of training on how to reverse Crohn's and colitis. We take them and put them on YouTube. They're available on the podcast. If you just head to the gutsolution.ca, you can go to the podcast section, free stuff. There's tons of information and advice. You can reach out, get help by clicking the Get Help Now buttons. We'd be happy to reach out and talk about this, because ultimately, this is a very reversible condition. You're taught by your doctor there's nothing that can be done. It's bowel disease, it's chronic, it's inflammatory, we're all sick and we're all going to die. It's inevitable and just genetic. It's not that way. It's not as simple as taking some probiotics or some ivermectin for parasites. It's a very layered process, but it can be done. Your chronic condition is really just a long-term acute condition your body needs help getting rid of, but you're inflamed because it's still trying to get rid of it. It's never random. It's never because God plays favorites. It's just that your body's sick and it needs help, and all that can be done, but we'd love to share some of the information with you at gutsolution.ca.
Josh, fantastic. Like so many things, there's always hope. There's always help. And so thank you for being out there, being a lifeline for people. The work you're doing is really important, and it's been a pleasure to interview you. So thanks so much for coming on.
Thank you so much for having me.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.